Welcome to our impact report. I really hope that you enjoy seeing so much of the work that has been done across Bedfordshire by the team. We're a relatively small team, but we are so passionate about working collaboratively so that we can identify where the key gaps are and where we can work together to make the biggest difference and support those who face many challenges to be physically active.
Over the last 12 months, we've put a lot of time and energy into developing sort of really key relationships with those community organisations that sort of best represent key areas of the local health system. So part of that, we've used our active medicine training tool that's trained over sort of 50 professionals from housing associations to public health colleagues to local healthcare professionals, all with the skills and confidence to be able to talk about physical activity and ensure that they're having their support in their conversations with their patients and residents and ensuring healthier lifestyles. It's sort of enabled us to help implement our people plan and support the delivery of that process. And we've done a really nice piece of work with a couple of organisations called Somali Voice Enabled and Modern Valued Education that support South Asian women that have undergone female genital mutilation, just to be able to teach them how to learn how to ride a bike and provide them and break down some of those cultural barriers that they've previously had. And then for the last sort of 12 months or so, I've supported a variety of different organisations to receive roughly in combination over £30,000 worth of Sport England funding, all of which have enabled them to deliver projects that have targeted those underrepresented communities to become physically activity in one way or another. We've done some really nice work with Your Life over the last 12 months, and during COVID they'd purchased a log cabin that sat on their car park to allow them to have daily access to their members and be able to deliver to those members throughout COVID. As we came out of COVID, this cabin needed repurposing, so we managed to source some funding through Luton's Healthy Weight and Physical Activity Fund to repurpose that cabin into a fully purposed and built gym. So as part of that, we've trained the staff and built them an on-site gym that residents are able to go into whenever they feel they want to, and provides them more opportunity to be physically active across the day, which is great. Really sort of focused on how can we bring our community and collaborate better with our partners across the last 12 months. So as a part of that process, we started to develop some county networking days. So with the focus on creating positive experiences for disabled people, we brought 23 different organisations into the room and had presentations from the Activity Alliance, from the Disability Rights UK, and ensured that we've got a really good representation from some local experts who formed our panel conversation. Some that are living with disabilities or have been working in the space for a long time and have real expertise and knowledge that helped shape our conversations going on in that event. So it was centered around how can we better co-produce and hear the voices of the disabled people and use that as our focus and as our drive to shape the programs and deliveries and work that we're doing moving forward. So really, really nice event.
Distributed leadership is a really key driver for Be Active. If we're going to make long-term change and support those that need the most support to be physically active, it's really important that we help empower and enthuse and provide motivation for those individuals in the community so that they can take hold and take responsibility to put things in place to support those in their neighbourhood to be physically active. A really good example of this is the faith-based centre work that we've been doing with Active Luton. We've had a really good opportunity there to identify leaders within those faith settings who, with our support, have been working on getting skills so that they can run physical activity sessions themselves. So that will really be embedded in that space and should be sustainable for the long term.
There's a lot of benefits. The benefits are very much monumental in terms of what they do through Active Luton and us as we're delivering it. And then obviously the disabled people and people with special needs, as well as the caretakers. I suppose it kind of allows them to have a social element that they might not get back in the care homes and stuff like that. Simply being out and give them that fun factor of being away from the care home, being able to do fun and games, kind of let their hair down a little bit, and then also kind of building relationships with the caretaker as well. So I can only imagine that will kind of make things easier.
I really hope that you've enjoyed this impact report. I hope that it comes across how passionate and committed we are as a staff team to really do what we can with partners across Bedfordshire to collaborate, work together, identify where the greatest need is so that we can really support those people in Bedfordshire to move more.